All right, so we're kind of middle of January here. Ryan's now been with us in Mobile for 6 months, and I'm really enjoying having an associate and a partner. We kind of work together, plan together. We help each other in the operating room, and what we kind of do right now is at the end of every week is look at the week that's gone by and review it and kind of look at what's coming up. So, Ryan, I'll let you start. So what did you do this week?
I had a great week. So, I took off a lot of skin cancer this week. So, mostly on the head and neck, which is a fun challenge because you really have to find a way to put it back together in a way that it kind of blends naturally with the natural facial creases, natural facial lines. And I really felt like we got everybody a very good result this week. It should look good long term. We did an interesting cosmetic case this week, which you were there for and helped me out with. It was labiaplasty, which is probably more common than most people imagine. I know we both do more of that than most people would probably imagine, but this is a little bit different. Most labiaplasties are the labia minora, or the inside of the vagina. The labia majora is the external portion, and we see that often in massive weight loss patients. And so, it's a little bit more of a challenge, but I really felt like we were able to get that patient a great result.
Yeah, it was a good case. I mean, weight loss patients can get extra skin everywhere, and that's just another place they can. Whereas the labia minora is usually, if it's hanging too low, it can be uncomfortable or look poor.
Right.
So that was interesting. I mainly did breast surgery this week. I did a patient that needed straight up implants, did a patient that needed implants and a lift. I did some breast reconstruction for cancer patients. I did some later stages for breast reconstruction patients. Did a couple of breast reductions, a few skin cancers as well.
Overall, it was a very busy week, and a week that is kind of fun for us because we actually got to operate together a lot, which is kind of cool. And I think we have a lot of good cases coming up next week as well, which is very nice in January. I know I have some good breast reconstructions coming up next week, and also kind of an interesting case of a leg reconstruction that we'll probably talk about next week or the week after, whenever we kind of figure out how we're going to get it all done.
Yeah.
So.
Yeah, I mean, this week wasn't in particular, but we've been doing a lot of facial rejuvenation. It's winter time. A lot of people like to do facial rejuvenation then. So we've done a bunch of facelifts and eye lifts and brow lifts, those sorts of things. Mardi Gras is about a month away, and I had a normal clinic today, but half of it was non-surgical facial rejuvenation. Did a bunch of injectables, Botox, neurotoxins, fillers today, which is nice. I mean, there's always a risk of some bruising and some swelling, so you want to do it a couple weeks before all these Mardi Gras balls and things start. So it's a good time to be doing that. Then people are starting to get ready for summer and spring. It starts early around here. Winter doesn't last very long. So
Right.
You've been doing some liposuction, smart liposuction. I do a lot of tummy tucks and
Yeah, I mean, I think it's always nice to have a clinic where you do a lot of injectables. It helps to kind of break up the day, and it's also just kind of fun to do. And what's fun about injectables is that more or less it's immediate results. I mean, the Botox or Dysport will take about a week or so to kick in, but fillers are kind of fun because you get to see the results that day. And again, some bruising and swelling, but it's always things that you get to leave the office immediately kind of feeling better than when you came in, which is always nice.
Yeah, and just like how breast implants options have exploded since I've been in practice. I mean, our palette of options for fillers is exploded. I mean, it's pretty amazing all the different options we have and what we use them for different purposes. It's kind of making it more fun, to kind of really design and proceed with a plan. So it really makes a nice difference. And then probably the most interesting case I did, which is just interesting to think about this week, was one of the patients that got lift and an implant actually had a breast reduction 20 years ago. So she already had the scars and she had the benefit of breast reduction, but 20 years have gone by, they've sagged again, and she's lost her volume and she's gone through hormonal changes, including menopause. So even in a patient with previous breast reduction, sometimes we come in and use an implant for upper pole fullness, and then we tighten it up and shape it all up again.
Which again is nice that we have so many different options in implants these days to kind of fit every different patient a little bit differently.
Right. So looking forward to it.
Yeah, gonna be a good week.